Just wait for 1 or 2 minutes for all the participants to come up. So till that time, let me ask few questions to our audience. So how about Dr. Biplab Majumdar? So you see, Dr. Karan Nagna has shown you, right, the club hand. And the reason of that club hand was hemimelia. So can you mention a few other diagnoses where you can see club hands? Just mention the names, I will repeat this. So any infective cause. So if that causes any shortening of any one of the forearm bones, it may cause any club hands. Any other disease? Growth plate arrest. Very well. What is the most common disease where you can have a growth plate arrest resulting in a club hand? Anyone? You can have. You can sit down. Hereditary multiple sclerosis. So I just wanted all of you to know few differentiating points between this hereditary multiple exostosis and hemimelia. So both of them cause the similar deformity at club hand, either towards the radial side or towards the ulnar side. But if you look closely, you remember that hemimelia, that means there is a problem in the developmental process. So not only the bones, but the muscles and dermatomes and everything can be affected. So even if you correct it, they may not have the sufficient muscle power to use that upper limb. But it will not happen to the hereditary multiple exostosis. Here, developmental process was okay. Only the exostosis, which is the disease of the periosteum, that causes some sort of arrest in the growth plates and causes that limb to be shortened and causes the deformity. In hemimelia, if there is a radial hemimelia, it may be frequently associated with absence of thumb or index, right? I found that then the little finger or ring fingers. But if it is an exostosis, fingers will be completely okay. So these are the few differentiating points you just keep in your mind. So whenever you see a club hand, first look at the fingers, whether they are all present and similar or not. And then look at the muscle thickness, whether there is any wasting or not. If those are present, chances of hemimelia is more. If those are not present, then it can be a case of exostosis or post-infective phase. Now this is not an exact rule, but just a guideline. So let us proceed. I'm going to show you one case on hereditary multiple exostosis. And all the treatment options are very much similar like hemimelias. The principle is the same. Increase the length of the shortened bone. And this is a common deformity whenever our limbs have two bones, both in the legs and in the forearms. If one bone is somehow shortened, then it will have deformity to the distal part. So the basic principle is always the same. Increase the length of that deformed bones. So let us see. So my patient, 8 years old girl. She is already a diagnosed case of hereditary multiple exostosis, and for last 2 years she started to have a deformed forearm at the wrist level, which is gradually aggravating with time. And we go by traditional method. We excise the exostosis of the distal ulna and started lengthening it. So let's see what happens. So this was the first X-ray after the operation. We have almost resected half of the ulna, and then we started to increase the length by doing an osteometaphyseal abrasion. And then we started to gradually increase the length of the ulna. And by the end of 2 years, with the help of a KY, we guided this growth. And at the end of 2 years, you can clearly see how much long the ulna is lengthened. And there is another important thing. As the ulna was very short, so their radial head was already dislocated, just like in Montasia. So if you look closely, when we gradually started to lengthen the ulna only, very interesting to see that the radial head also started to come back into its normal position. Not exactly as it is, but much better than before. So this is about 2 years follow-up, and almost after 2 years, lengthening is completed, the distal end almost reach up to the wrist. If you look closely, the radial head is now very much well located. Not a very completely like a normal, it's almost like a normal. And this is at the end of 2022, so almost 2 years have passed. The child was at that time was near about 10 years of age. And he has got a very good function both at the wrist and in the supination and pronation. Sorry sir, I forgot to put that. So that has involved the lower 1/4 of the ulna, but when we resect it, it almost causes half of the ulna to be gone. So once we achieve that one, this one, then we just simply remove the cable and she was having a good range of movement. But as the time passes, so she was 10 years of age, as the time passes, she again started to see that wrist is again started to deviate. So what is happening? Anyone can guess? We lengthen the ulna completely up to the wrist. Both forearm bones are almost equal in length. All the deformities are almost nearly corrected. And both parents and myself was very happy with that. But as the time started to progress, they noticed that similar problem is again coming back. So anyone have a guess? So you see, this is the problem of the distal radius physis. The other radius has got no problem. So that one is still continuing to grow. And the child is now from 8 to 10 years of age. As she is female, so she still have 4 years of growth remaining. And that is actually causing the problem. After 2 years, she revisited to me. She contacted me over phone. I asked them to come to a visit and they said a lot of process has already been done. We want to observe. So if it is not that much aggravated, we will not come. So they do come after 2 years with the appearance of like this. If you look the last X-ray, look at this. Bowing radius was still there, but the both bones were still almost in the same length. But unfortunately, ulna remains at that same length right now. It is not growing that much, but the radius is growing very aggressively, and the distal radius has now started to bow abruptly because the supporting contralateral bone is not over there. So, what was my mistake? What did I do wrong? Or what should I say? What can I do better at that moment? Not just leaving the child on their own. Which one? So you suggest me that while I was removing the cable, I should correct the bowing of the radius also. Do you advocate any shortening of the radius for during that time, sir? Okay, so you are advocating to correct the distal radius only. Anything to do about the proximal one, because the proximal radius is still not perfectly aligned.
You can like line that of the social operation. What I do. So the two levels are sustainable and put a cable and then it will straight and it will be like that as it is.
Okay, so the point to remember that the child is still but 4 years of age of growing, so you just simply cannot leave it alone. The mistake that I did, I actually just only asked them to, if any problem, you can come back later on. But they do come after near about 2 years, where it is almost very much deformed right now again. And remember, now she is 12 years. Though the growth rate is not very much visible here, I checked the knee joint and growth rate is still very much active. So still another 2 or 3 years growth is still remaining. So that I could do at that time.